Okay, so we got a question which, kind of perfect common sense, which is, if I'll try to rephrase it. Dr. Rutledge, I hear this, you lose weight, your diabetes gets better. But, let's be real. What if you've been a diabetic for a long time? As you get the diabetes for a longer time, your insulin production goes down. It's not just fat, is it, Dr. Rutledge? And all the surgery does really is decrease your weight. So what's the deal on the mini-gastric bypass and diabetes? And this is just tremendously interesting new research that's just really, really exciting. Because a lot of the kind of unstated things in what your question are things we found out are now wrong. And there's exciting new research. For example, the gastric bypass itself causes hyperplasia of the beta cells that create insulin in the pancreas. In other words, more insulin and more beta cells in the pancreas. The bypass itself causes an increase in the pro-insulin hormones, glucagon-like peptide and gastrointestinal peptide. So not only do you lose weight with a gastric bypass, but what you do also is you change the whole nature of the hormonal system in the body. And so up to 85% of patients are completely cured off all of their diabetic medicines after the surgery. Everyone is improved, and 85% are off all medicines. So it's very exciting. It's not just weight loss. And we know it's not just weight loss because they've taken mice, and a French group did gastric bypasses in mice. And so, so they did gastric bypasses on mice, and then they took another group and they watched the weight loss in the gastric bypass mice, and they held back the food on the control group so that at every time interval, each group had exactly the same amount of weight loss. One because they got less rat food, and the other because they had a gastric bypass. At the end of 6 months, these mice, which were interesting because they were selected because they were obese diabetic mice, they compared the results. Weight loss was controlled to be the same. Diabetes resolution was much better in the gastric bypass group. Same weight loss, different effect on diabetes because the gastric bypass is more than weight loss. In fact, it's a change in the pancreatic beta islet cells, it's a change in the pro-insulin hormones, and in many cases now we're on the threshold of saying we cure diabetes. So it's a really good question. And it's not 100%, but it's close.
What is it about the surgery that causes hyperplasia of the beta islet cells? And is it a decrease in pro-inflammatory cytokines?
Well, we don't. That's a good question, which I don't think we have yet. We know that there's something about the foregut, the flow of food and the other hormones that goes through the duodenum and through the upper small bowel modifies the hormonal profile and affects the pancreas. And when you bypass that, that's when these changes happen. There's something about, it's called the foregut, which is the beginning of the small bowel, the foregut hypothesis. Which one of those things that does it, we're not sure yet. But what's clear is there's a gigantic effect on diabetes and diabetic hormones because of the bypass, which is different than just weight loss alone. Because some people say, well, Dr. Rutledge, I think I'm going to just try and treat my diabetes by diet and exercise. And should you do that? Well, there's nothing wrong with that. That's a great choice. But as far as the therapy of diabetes itself, the gastric bypass is a profoundly positive therapy of diabetes. It's a really exciting, really different thing than diet and exercise alone. Now, should you eat a healthy diet and exercise? Yes. But most diabetics have a close to 0% cure rate without surgery. And with surgery, we're over 85%. So it's not just a minor difference, it's a huge difference. So in other words, look at diabetics and tell them to lose weight and exercise and diet on their own to get rid of their diabetes. The success rate of that therapy, not quite zero, but close. The success rate of the gastric bypass, in our gastric bypass, the mini-gastric bypass, over 85% cure. And the rest are all improved. So it's pretty profoundly different. It's not like the presidential election. It's 53% versus 47%. I mean, it's close. This is 0%, 85%. Huge difference. So that's a very good question.
And so that 15% have had it longer but don't get cured?
Oh, yeah, good point.
Larger
They have the longer and more severe.
Yeah, right.
Right, exactly. So if you've had it more than 5 years, if your insulin dose is over 300 units, those patients are less likely to be cured.
Sure, that makes sense.
Yeah, but a really good question. A really exciting area because it brings up one other thing. What if you're not that heavy and you're diabetic?
That's right.
Yeah.
Sounds like me, that's why I'm worried.
Yeah.